Hi, my name is Mike Larson, and I'm a body MRI and cross-sectional interventional radiology fellow at the University of Arizona Banner University Medical Center in Tucson. Today I'm going to be talking about patient-friendly summaries of ACR, or American College of Radiology Appropriateness criteria. Are they really patient-friendly? So the American College of Radiology is encouraging radiologists to engage in patient and family-centered care. Health literacy of patients and their caregivers and families is one of the biggest drivers of healthcare outcomes and compliance. Health literacy is the ability to obtain and then understand that health and medical related information. RadiologyInfo.org is a national patient-oriented website made in conjunction with RSNA and ACR, and it aims to provide a comprehensive resource on radiology for patients. And it has actually been criticized for being inaccessible due to being written above the average American's reading level, and that encouraged by the American Medical Association. These summaries, there's actually new appropriateness criteria summaries for patients over the past 3 to 5 years that have come out to help explain things to patients, and these can be found online at the reference or at the link on your screen. And to date, no studies examine the readability of these resources. So the purpose of this project was to evaluate the patient friendliness of the American College of Radiology patient-friendly summaries of appropriateness criteria. And to do this, we downloaded all 62 available appropriateness criteria patient-friendly summaries, and we removed the titles, subtitles, and kind of other text that was outside of the main body, and then ran that through a readability calculator that provided a Flesch Kincaid reading level and other measurements of readability. These are widely used pedagogical metrics that assess how easily something can be read. Here are some of the results, with the key in the upper portion showing the grade level based on the Flesch Kincaid score, with 8 being below the 8th grade, which is a recommended or the average American reading level, 8th through 10th being kind of the yellow, 10th through 12th high school level being orange, and then college level being red. And so you can see this is cardiovascular and IR related topics, that all of these were at a high school or college level. These are the results of the neuroradiology related patient-friendly summaries. Trauma of the head in a child had a Flesch Kincaid grade level of 7.7, which is right on par with the average American's reading level and in accordance with the AMA's recommended. Regarding MSK, and here are the results for chest, abdomen, and pelvis, women's imaging, where most of them have high school to college level reading levels. So with one exception, content from the patient-friendly summaries of the ACR's appropriateness criteria is actually above the average American reading level and the level recommended by the American Medical Association for patient-oriented information. This puts patients at a risk and disadvantage because they don't understand the specifics of their medical or radiological experience. They are less likely to be able to make informed medical decisions, especially about radiological exams, and are less likely to have healthcare specifically tailored to their needs. With recent laws passed mandating patients have access to their electronic medical records, more will be turning online to find resources to guide them in making medical decisions. So this issue needs to be addressed to facilitate better patient understanding, experience, and outcomes. So limitations with this, we did not evaluate any graphics, which could be very helpful. Additionally, in defense of RadiologyInfo.org being well above patient, the average American's reading level, studies have shown that the average patient seeking information online will have a higher reading level than the average American. For future directions, we've submitted an abstract to RSNA 2021, which includes more data beyond just Flish, Kincaid reading level. Additionally, we are evaluating the readability of radiologyinfo.org, SIR Web, and other national databases and comparing these to private practices and other academic institutions. And we might as well author some of these appropriateness criteria, patient-friendly summaries, and encourage you to consider doing the same. Submissions are always open, and the website where you can submit is below. Thank you.